Hi everyone. Okay, so a lot of you have been asking me, what is a thread? Is it really strings in my face, or can you do those strings that lift my face? Well, technically they kind of look like a string, but they're way more than that. So let me demonstrate for you this. Can you visualize those little barbs? So they look like little spikes. You see that? I'm going to try to focus on there for you. So this essentially is grabbing that tissue and allowing it to reapproximate those fat pads that descend or fall over time. Yay, gravity, right? But really, let's talk about why. So obviously heavier tissue falls faster, but in all reality, muscles and ligaments, they weaken as we get older, just like how our muscles get sprained easier and our ankles as we get older, they elongate and they stretch, so everything tends to descend. So where does PDO Threads come into play? Not everybody's a candidate, and that's my job to determine, but I encourage you to come in for a free consult. We go through an hour-long in-depth educational experience for you to make sure that you're in good hands and that we give you the right tools to make the right decision, regardless if it's not threads. So threads, PDO threads, we like to use PDO threads, polydioxanone. These are basically sugar molecules. They were actually first originated in medicine and cardiothoracic surgery. And essentially, we've now implemented them in the aesthetic world. We load a cannula on them. So this is a cannula. So cannula is essentially a blunt-tipped object. If you look close enough, there's nothing sharp here. It could be sharp if you jar it hard enough. But more importantly, I stand for regenerative aesthetic medicine. That's going to help naturally regenerate that collagen stimulation that we all lose year by year. This is not changing your look. It's just making you gracefully age along the way so that you look and feel better about yourself. So that's what PDO threads do. There's tiny little smooth threads as well. Tiny smooth threads. So smooth threads are PDOs as well. But you can't even see that. Can you appreciate how tiny this is? See that little guy at the end right here? So that is basically, I always like to pull out one of my hair strands and show you. So these are tiny little threads. These will break down in 30 days. We love to layer them in this region, the pre-jaw sulcus, smile lines. Even that can support the temples and brows if you do enough of them to really promote collagen. We love it in the under eyes as well, neck lines. Very easy, no downtime, essentially. Maybe a couple little zingers with some smiles, but you're good to go in about 2 days. Leaves back collagen. You want to do a couple rounds of these. These are more for collagen stimulation and tightening of the skin. These are more for lifting. So there's a lot of great combo therapies that we can do, not only with threads, but that's once again our job to make that determination. So that is your fun tip for the day regarding PDO threads. Let me know if you guys have any questions, comment questions below.